This is something that is new. It's never happened before.
This Montreal hospital is one of many struggling to keep up with COVID.
To look at all the beds in and around the city of Montreal and say, like, there's no beds left, that is a first. And of course, this is something that we're working really hard not to get there.
Right now, nearly 2/3 of designated COVID beds in Montreal hospitals are occupied. So today, a warning from officials. Within the next 3 weeks, the need for beds could surpass hospital capacities.
There are capacities of adjustment, so we're not at that point, but certainly it's a signal of the importance of the burden of risk for the hospitals, namely.
Hospitals are working to make more room, but cases are climbing at an alarming rate. In the past week, someone in Canada died from COVID every 11.5 minutes on average. As of today, there are more than 700 COVID patients in intensive care units. 165 are in Quebec, but 337 of them are in Ontario. That's the province's highest number yet. Today, Ontario also set a new record for hospitalizations, 1,235 people.
It has become a daily occurrence where we're having bed spacing issues, where there are critically ill patients in the hospital and in the emergency department, and we're having to figure out new ways to get them into the ICU.
Since the start of the pandemic, the great fear has been a repeat of those horrific scenes in Italy, where doctors had to choose which patients to save. It's a possibility doctors here are now preparing for.
Certainly we have thought about it. It's not something easy to think about or easy to do, but it may end up becoming necessary if things continue to get worse.
To avoid that outcome in 2021, doctors are pleading with people to stay home and avoid spreading the virus. Jayla Bernstein, CBC News, Montreal.